Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Nita Valens.
Well, hi there, Dr. Darrow.
Nita, you're looking beautiful today. How are you?
Why, thank you. I'm good. I'm great, actually.
Wonderful. Me too. I'm living it up.
Well, that's a cool thing because maybe then we can be an example to our listeners so they can live it up.
I hope so. I mean, one of the greatest things I think people can do is help each other with a great attitude.
And to stay positive during these times is a challenge. So we want you to call 866-870-5752 right here in the studio. And when you do, you get not only to speak to Dr. Darrow, which is a treat, but you get a free book today, Dr. Darrow's latest, and it's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate, with 264 scientific studies. So if you're new to the program, it would be a great introduction to you. And you want me to go on, give the website and all that kind of cool stuff?
I can do some of this right now because I get jealous when you talk. So what we're here about today is healing your musculoskeletal pain naturally without surgery. And I always say this on every one of my shows. I love surgeons. I was studying to be an orthopedic surgeon. And then I had an orthopedic surgery on my own shoulder, which came out bad. And that kind of jilted me out of that idea of doing that to people. And I know there's a lot of people that need surgery. I had an adrenal tumor. I flew up to San Francisco to a surgeon that had done the most of those and had a great result. But for the musculoskeletal system, unless you have a broken bone or a dead leg or something pretty radical, in my personal opinion, the best way to heal is using your own cells from your body. We take the platelets out, we take the bone marrow out, and then we inject that into the area where you're having the pain. So this is not a panacea for every disease in the world. I don't treat disease. A lot of people are kind of scamming the public by offering stem cells for different diseases, diabetes, multiple sclerosis, blindness, you name it. And at this point, that to me is kind of a scam because it's at this point. Tomorrow, we may have the evidence that shows that can work, but I haven't personally seen it yet. I don't do that kind of stuff in my practice. I don't do IVs, intravenous, in my practice. There are people that do, and God bless them. God bless everybody. God bless the patients. I hope you all get better, but I haven't seen the evidence yet to do that. But what I do see the evidence in is to use these cells to help inject the body in terms of the musculoskeletal system. That means the joints, the ligaments, the tendons, and things like neck pain, back pain, arthritis, anywhere from the shoulders with rotator cuff tears and the knees with meniscal tears. You name it, anything around the body. I do anything from really the back of the head all the way down, and elbows, fingers, wrists, all the way to the hips, and obviously knees. We get more knees than anything else. A lot of knee arthritis, meniscal tears, ACL ruptures, you name it. And then on down to the ankles and toes and bottom of the feet, plantar fasciitis. That's a big one for a lot of people. So it's a real simple concept. It's a natural process that's been around since the beginning of time. And there are there are reports of the Chinese in China doing these kind of procedures back 5,000 years ago with needles, heating up needles and forming sort of a new collagen around the area. And this is a way of doing it today where all we do is a simple injection. It's very simple. Before I drone on, Nita, I'm going to give out the phone number, so hopefully we can get some callers.
We have Dino waiting for you.
Oh, okay. Hang on one second. Let me go to the call board here and see what Dino, your father has a bad shoulder. Excellent. Before I get to you, Dino, I'm going to just give out the phone number, and that's 866-870-5752. If you want to talk to me now, I would love it. It's 866-870-5752. And if you do call in, you're going to get a copy of my new book, newer book, I should say. It's not that new yet, which is Stem Cell and Platelet Therapy, Regenerate, Don't Operate, $25 book. I'm going to mail it out to you for free. Just give me a call. The other things are the website has tons of information on how to heal naturally in the musculoskeletal system, and it has a spot on every single page how to email me personally. Okay, so the website is www.lastemcells.com, www.lastemcells.com. And if we miss something about what you want to hear about, you can always call my office too. And there's people by the phones most of the time. If not, you can leave your name and phone number. We'll get right back to you. And that phone number to the office is 800-300-9300. 800-300-9300. So, Dino, I'm going to talk to you. Debbie, you hang on there. We're getting more callers in here, thank goodness. Otherwise, I have to tell bad jokes.
Oh, it's awful.
It is. So, Dino, your father has a bad shoulder. What does that mean, and how old is he?
Yes, he's turning 90 years old this year.
Okay.
And
We say
about his
Nita and I say 90 years young. But go ahead, I'm teasing.
Okay, very good. So he's complained about his right shoulder for a few years, but in the last few months, it's become agonizing pain where he's gone to ER several times.
Ooh. Yeah.
And it's basically a treatment of medication, stronger medications each time.
Yeah.
But he did go to the hospital a few days ago, and they actually admitted him to the hospital. They aspirated his shoulder, took out some fluid.
Yep, that's a good thing.
Shot,
that's not a great thing.
And they came out of the hospital thinking, okay, this could be it. But he went back to the ER again last night after just being out of the hospital the same day.
Well, I hear it from people all the time. I have patients come in, they go, I had an aspiration in my knee. Actually, I had a lady come in yesterday with a great big bruise on her knee. And I said, what? She didn't come in for her knee, by the way. She came in for TMJ, temporomandibular joint, and low back pain. And I just happened when I was examining her, I saw this big bruise on her knee. I said, what's that from? She said, I went to the ER because my knee hurt. They aspirated it and then stuck cortisone in it. And I said, really? And how long ago was that? She said, that was a week ago. And I said, well, why are you telling me about your knee now? I mean, she said, it still hurts. She said, well, it lasted one day. The cortisone lasted one day. Now, the thing that people don't know about cortisone, and you can look this up on Google, I'm a big fan of Google. And Google's great because if you want to see anatomy, you type in the word like, let's say, knee or shoulder, and in the upper left-hand corner, there's a spot that says images, and you just click on that, it'll show you the anatomy, which is a very cool thing. There's a lot of anatomy on the internet. So my point is, if you check in and you Google cortisone or steroid and the word cartilage, you're going to see that is not good. That's not a good medicine for the cartilage. It dissolves it away. So in a sense, if it does work in the sense that you get rid of pain, because it's a really strong anti-inflammatory, so often the pain will go away, but it's short-lived typically. And in the meantime, the cartilage is being eaten away. And it's worse on knees and the lower extremities than it is in the upper extremities because those are weight-bearing, and then you're kind of grinding it down from gravity, plus the deleterious effects of the cortisone or the steroid, whichever one is put in there. So, your dad is 90. They're probably thinking, who cares? he's not going to live long. It's okay if we're going to add some more damage to the shoulder if he gets some relief. And it is a great idea to take that fluid out. But if he were to come to me, instead of putting cortisone in, I would have put in some platelets or stem cells and helped regrow the cartilage instead of help break it down. Does that make sense to you, Dino?
Yeah. And which treatment is better between those two that you mentioned typically?
I always try to think of analogies because I get asked that by every new patient, that question. And it depends on, the analogy depends. I say, what kind of work do you do? And then I can give an analogy. So let me see if I can do it with you. What kind of work do you do, Dino?
Me, myself, or my father?
You. What do you do?
I work in quality, manufacturing quality.
Manufacturing quality?
Yeah.
I don't know what that means.
The company I work for is a manufacturer we manufacture toner cartridges, so I manage the quality end of it.
So you're quality control. Okay, so let's pretend that you have 10,000 cartridges to analyze, okay? Do you want to do that alone, or would you rather have a team of other people doing it so you can get through it and get it done?
Of course, a team.
Yeah, a team. So that's the difference between using platelets alone or platelets plus stem cells. The team is a much better effective model, and there's different ways that it assists in the healing. Now, platelets are good. We only had platelets for many, many years. Before that, we only had things like concentrated dextrose back in the old days to create an inflammatory response. And then I've tried a lot of different things. Sodium moreuate, I stuck that in my elbow one time for lateral epicondylitis, tennis elbow, and that hurt like heck. And my arm was bent in 90 degrees for about 2 weeks. I was an experimenter back then. I didn't really have teachers. I was just experimenting with this stuff because it worked on my wrist. Overnight, my wrist got about 50% better after a shot of what's called prolotherapy, which I wrote a book about also years and years ago. But since those old days, when I started doing this almost 25 years ago, during my residency at UCLA, it was like 1997 I started doing this. And it's morphed. We've gotten better and better technologies on how to heal the body. So along came platelets, and I started using that and did thousands and thousands of those for years. And then when the stem cells came along, I started doing that, mixed with the platelets. And I did thousands of those, probably, I don't know how many, 6, 7, 8,000 of those. And the technology hopefully will get even better. My hope is that soon we will have a company that produces a synthetic that can grow back the cartilage even quicker than what the stem cells do. But at this point, this is the best that I know of. Okay? I know that there are some people that do this IV. There's a guy down in Panama who does that and charges a lot of money for it. And I've had some of the patients come back up here and tell me the IV didn't do a thing. They felt good for a few days, and then it came back. So I'm not into the IVs. I don't think my medical board would like if I was doing IVs with stem cells, so I stay away from that. I'm not treating disease. I don't think they like that either, and I haven't seen the results in that. But for using it for musculoskeletal orthopedics, for me, in my practice and my patients, it's been amazing. I've done it on my wrist, both elbows, both shoulders, both of my knees, and I've had amazing success over these years. It's kept me in the sports game. So I hope that answers some of your questions about your dad. Is he able to lift up his arm at all?
Up to his mouth, like he's drinking coffee. That's the limit of his rotation.
Okay, so he is semi-functional, which is good, right? It's not locked down to his side. I've had both of my shoulders locked where I couldn't lift my arms at all, and I healed both of them. They weren't at the same time, but at different times from different injuries. I've had both my arms locked up, And I'm on a video camera right now. I'm lifting my arms up to show everybody. I'm waving my arms up in all the way in full range of motion. So this stuff works. It doesn't work on everybody for several reasons. The main reasons it doesn't work are real simple. Many patients go to doctors who don't know what they're doing. They say they do it. It typically doesn't work if you go to an orthopedic surgeon because they don't believe in it and they don't do enough of it. They'll try it, or they'll tell a patient, I'm going to try this, and if it doesn't work, then we're going to do surgery. So they try it once and it didn't work because it doesn't work like that. It's growing tissue. It often takes a few treatments. And if there's pretty severe arthritis, that could take a lot of treatments. I've had parts of me that have healed overnight after I've injected myself, and parts that have taken months of treatments. I never can predict. Patients always say, how soon am I going to heal? I go, I wish I knew. I don't know. Because some of the easiest cases are the hardest to heal. And some of the hardest cases that seem hard are the easiest to heal. Let me give out my phone number. We just lost some callers here because they got bored, I guess, listening to me. The phone number to the studio right now is 866-870-5752, 866-870-5752. Please call now. I will give you a free copy of my book. I'll send it out for free. Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It's got the foreword written in here by Suzanne Summers, who is a great advocate of what's called alternative medicine, which to me is not alternative. It's the real medicine. It's the true medicine. It's the healthy medicine. It's the medicine without drugs and surgery. It's the conservative medicine. And when used properly or in conjunction with traditional medicine, I think it's amazing. Sometimes you need traditional plus, quote, alternative at the same time to help people heal. And I've been trained in both. After my residency, I had a 4-year residency after medical school at UCLA. And after that, I did another fellowship in functional alternative medicine because I was always interested in natural healing. So I actually did an acupuncture course at UCLA, a 3-year acupuncture course. That was a really tough course. And I don't really do acupuncture because I didn't find it as effective as the work that I do now. But in the right hands, I think acupuncture can be super effective. And I like all kinds of healing. I don't really care what it is. If it works for someone, I'm interested and I like it. I go to chiropractors. One of my favorite chiropractors is Randy Weinzoff in Santa Monica. And if someone has, let's say, back pain and leg pain, what we call a radiculopathy, I'll help heal the back, and then for the leg stuff, I'll send it to Randy Weinzoff, who's a chiropractor, because he can often align the spine. I can fix the ligaments and get rid of a lot of the sprains and strains all over the spine. Most spine things that I see are really ligamentous in nature. Now, that doesn't mean you don't have a herniated disc. You may. You may have facet arthropathy. You may have arthritis, all these things. But that doesn't mean that's where your pain is coming from. And, you have to be careful, Dina, with your father, that he's not branded with a diagnosis that sounds surgical, okay? Because I see that every single day, all day long. Patients come in, they go, I've been to orthopedic surgeons, I've been to neurosurgeons, I need to have surgery. They all tell me the same thing. They showed me the MRI, and then I touch their back and examine them, and I go, you don't need surgery. This is not a surgical case. And they go, why'd they tell me that? I go, because we're in different camps, different cultures. The culture in orthopedics and neurosurgery is very often about looking at an MRI to decide what's going on. Now, I'm not saying that they're dumb guys, because they are not. They are brilliant. Brilliant, brilliant guys. It's really tough to become an orthopedic surgeon. You got to be the top of your class, or a neurosurgeon, because everybody in the med schools want to get into doing that because it's a great future and it's great work. But what I'm saying is a lot of these surgeries should never have been done, because I get patients all the time who have had failed surgeries in great hands, in great surgeons' hands. It's not a put down on the surgeon. It's just there's human error, and I don't want to be at the end of human error if there's a knife in my body, if you understand what I'm saying. So I always consult my patients, be conservative first, do all the conservative things you can, go to physical therapy if you need to, if you think that'll work, chiropractic, acupuncture, massage. There's a million things out there. And if I think I can help, I'll tell them that. If I think I can't, I'll tell them that. And the thing with your dad is be careful not to have him have a surgery for a lot of reasons. Number one, he hasn't tried regenerative medicine yet. He hasn't tried platelets and stem cells. That could be a quick fix for his shoulder. I wouldn't know unless I examine him. And the one thing that's disturbing to me is when people come in, new patients come in with a failed surgery. You know, they have a surgery, they're all glitzed out. I'm going to have a surgery, I'm going to be perfect. And then they get worse. It's very disheartening. And I go, did the surgeon ever examine you? And they go, no, why would they? They just showed me the MRI, and they showed me where the damage is, or they showed me an x-ray. They showed me the damage, and they said they were going to fix that. Well, that's not, to me, how you decide what to do with someone. You've got to do an examination. It may only take a minute. You know, it doesn't have to be very thorough in some cases. Some cases it does. But it could literally take 10 seconds sometimes to find the real problem, the pain generator. And so a lot of people come in with a failed surgery, they're miserable, and I examine them and I go, you never needed that surgery to begin with. They operated on the wrong thing. And a lot of things that people have pain with, you can't see in an x-ray or an MRI. All that makes sense?
Yes. You mentioned about the team approach. Is the platelets and the stem in the same procedure, in the same visit? Or
yeah, it's all in the same. It's all in the same. It's up to the patient what they want to do, but yeah, it could all be done.
Okay.
I mean,
you mentioned it could be one treatment can solve the problem, or it could be
sometimes. Yeah, sometimes. I never know ahead of time. I just never. I'm sorry. What was the question? Can it be a couple months before you heal? Is that the question?
Well, if it's over months, how many treatments or the frequency of treatments will be over months?
Well, the patient dictates that. I can advise them on it. When I'm treating my body, when I have an injury, I will often treat myself every day for a few days. People generally don't want to do that unless they're flying in from another country or something. They're time limited, then they'll do that. Most people generally will come in every couple of weeks. So we'll do a treatment, let's say today. They'll come back in a couple of weeks and we'll re-examine and assess them and see how they're doing. And then if they didn't get what they wanted in terms of healing, a lot of people will come back after the first treatment and go, I didn't get any better. And there's a lot of possibilities for why that is. And I didn't finish up what I was talking about with the failure of the work I do. It can be from too much activity. It can be from a bad operator, a guy who doesn't know what he's doing, or a nurse doing it that's not trained. Very often, first of all, I love chiropractors, and I go to chiropractors. Like I said, Randy Weinzoff is my favorite chiropractor right now in Santa Monica, and he's worked on me. I send him all of the neurological cases where there's impingement on a nerve, and I think to date, every single case I've sent him, he's resolved. So there's an email that I got in just recently that said, will stem cells work on my low back? Doctors say I need a fusion, which is a pretty radical surgery to me. I see them fail all the time. And the answer to that is, are you having back pain, or are you having leg pain, or are you having both of those? And if the answer is, I'm just having back pain, then it's typically something I can fix using your own platelets. We call that PRP, platelet-rich plasma, or mixed with your own stem cells. So we can do that and heal up the ligaments and the structures around the spine, anywhere from, the back of the head, the neck, the thorax, and all the way down to the sacrum and around the sacrum. And a lot of people say they have back pain, and it's really not their back, it may be their butt, the upper gluteus muscles where they attach to the pelvis. And then sometimes it could be the greater trochanter where there's 14 muscle attachments there. And sometimes people say, my hip hurts. And I check their hip, and it's not their hip at all. And it's where these muscles attach in the back. So there's a lot of examination that has to take place to really find out what's going on with the person. And so was your dad diagnosed with anything?
This goes back years, and he's described that he was given an option for surgery for his shoulder.
Yeah.
And so he describes it as being told it's like bone on bone. So that's
okay.
Whatever.
Well, it's not bone on bone if he can drink coffee, because that means he's lifting it up somewhat. It means there is probably some cartilage loss. But I get people in every single day who say they have bone on bone, and I examine them and I start laughing. And they go, why are you laughing? And I go, because you don't have bone on bone. I'm able to move the joint. Stick with us, Dino. You're a great caller. And I'm going to give out the phone number so other people can call in too. It's 866-870-5752, or go to my website, www.lastemcells.com, and you can email me from every page there. Hang with us.
And you're listening to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we'll be right back.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.